This is agriculture news that will affect you. Hello farmers, my name is Nicole Marie Broom. This is the agricultural news you need to know this week. Martiniquans now have access to free screening for the level of Chlordecone in the blood. Free access had once been reserved for agricultural workers and their beneficiaries, while the rest of the population had to pay up to €140 to perform the Chlordecone test. The streets of Fort-de-France saw almost 10,000 people demonstrating against a looming statute of limitations that would have hurt their compensation case for widespread harm done by the highly toxic insecticide. Recent studies into Chlordecone, also known popularly as Kepone, show that Chlordecone exposure to humans was revealed in 1975 following a poisoning episode at a Chlordecone plant in the city of Hopewell, Virginia, USA. Male workers there showed evidence of prolonged toxicity involving the central nervous system, mainly tremors, oculomotor dysfunctions, slurred speech, irritability, mood disorders, and recent memory loss. Enlarged liver and low sperm cell counts and decreased percentages of motile sperm cells were also observed. The symptoms and clinical signs were reported to be reversible for most workers after ceasing exposure between 120 to 160 days. Unfortunately, exposure in Martinique lasted from 1973 to 1993, a total period of 20 years. The Chlordecone test is a blood test taken in a lab in Martinique, which is then sent to a university hospital, the only authorized entity to detect the pesticide. French news outlet France 24 says the chemical Chlordecone has been linked to prostate, stomach, and pancreatic cancer, was widely used between 1972 and 1993 to protect banana plantations from insects in Martinique and Guadeloupe. Over 90% of the adult population suffer from Chlordecone poisoning, according to the French Public Health Agency. That's been agricultural news that will affect you. Stay tuned for another episode coming soon. Happy farming!